I think by and large they were confirmatory of what we already knew. So patients with the T315I mutation should benefit most from a 45 milligram starting dose in terms of MR2, so less than 1% BCR-ABL transcripts, in terms of major molecular response, and also in terms of MR 4.5. So the differences in this population is quite clear and favors the higher dose. In the other populations, no mutations or mutations other than T315I, the results are less impressive. And so for those patients, lower starting doses are an option in terms of efficacy. The key design feature of this trial is a mandatory dose reduction upon achieving the primary response endpoint. And so it's of interest to understand or to see whether patients who have this dose reduction will then after that maintain their response or will have a recurrence of their disease. And if they have a recurrence, will they respond to another dose escalation? So between 15, or if you count it slightly differently, 16 patients fall into this category and were started on 45 milligrams of Ponatinib, achieved the primary endpoint, and then were reduced to 15 milligrams. Roughly half of these patients had a recurrence of more active leukemias, that is, they lost the primary response. And so most of those patients, upon re-escalation, were able to re-attain this response. The other patients, again, roughly half of the population as a whole, maintained their response. So I think that shows that A, there's a substantial population of patients who do maintain their response, and conversely it seems to be safe to dose reduce, because even those who have a recurrence will regain their response after that.